that uh, Maghrib will also be soon. Anyway, Assalamu alaikum to everyone. Jazakallah for joining. Apologies for the delay in getting to you all. But Alhamdulillah. My name is Ahmed. I'm just the chair basically today for this meeting. And inshallah, I will be trying to my best to control this to the best of my ability. And we're hoping that by Maghrib we will finish. If anybody has any questions, everybody is on mute. So if anybody has any questions, if you can use the chat. So let's just use the chat, please, for the questions that you may have as you go along in the presentation. And at the end of the presentation, inshallah, we'll get Zubair Bhai, Shaukat Bhai, Salim Bhai, who will also be joining us, and the doctors who will be on the call to answer any questions that we may have. Any questions that we can't answer, inshallah, we will come back to you with some answers. As you know, things are changing every day. So obviously, as things change, then the strategy, etc., has to change as well. So if we can use the group chat, we'll leave the salams out now. Assalamu alaikum and wa alaikum salam to everyone. We just use that, please, for questions that you may have as we go along. Okay. So I'm going to hand over, first of all, to Brother Shaukat. Shaukat, it's all yours.
Jazakallah khair, Brother Ahmed. Assalamu alaikum wa rahmatullahi wa barakatuh, my dear respected brothers and sisters. First of all, Jazakallah khair. It's more than heartwarming to see how many of us have joined us on this conference call. Similar to a meeting that we had 2 weeks ago where we were arranging community work for regardless of which faith you belong to. And I think we had close to 90 people that evening as well. So alhamdulillah, our community has risen again. My dear respected brothers and sisters, I don't think I need to tell you the gravity of the situation we are in at the moment. We've seen the death toll around the world, across Europe, and then now it's unfortunately looks like it's going to be visiting us in the same vigor. It is possibly the most difficult challenge that we've ever faced within our community in this lifetime. But I would dare say that even our forefathers from majority of our communities have never faced anything like this before. So it was with this concern that several of us, people from individual backgrounds or organizational backgrounds, decided to unite in faith, unite for the pleasure of Allah subhanahu wa ta'ala, to serve the community, to serve our brothers and sisters, because everything that happens, we're all aware, comes from Allah subhanahu wa ta'ala, and this is from Allah subhanahu wa ta'ala as well. And it is what we do at this time that we'll be accountable for. This service that we're going to be providing, inshallah, is for our brothers and sisters, the ummatis of Prophet sallallahu alaihi wasallam, and we all know how beloved the ummati was to Prophet sallallahu alaihi wasallam. But in truth, the service that we're providing, we're volunteering for, could be quite easily be performed on ourselves and also on our loved ones. And we're all aware, or many of you must be aware, of the rewards that one gets for performing ghusl and burial. But the rewards for this, in this particular circumstances, I think only Allah subhanahu wa ta'ala will be able to, on the day of judgment, be able to tell us what He will be giving us on that day, inshallah. So once again, Jazakallah khair. The issue is this, that we have to still be acutely aware of the risk that is involved in this process. So many of you, if not all of you here, I think are on the group that have already performed ghusl before, but the ghusl that are going to be performed at this stage carries a certain level of risk. In the essence that if we do everything that is expected of us, that inshallah Dr. Saab and our other volunteers will go through, the risk is minimal. It's less than 1%. But the thing is, we have to perform everything with complete rigor and following the guidelines that inshallah Dr. Saab will go through with us today, and also in using our own intelligence, following the guidelines, looking at what the news is saying. We're all aware that if we're not capable of doing anything, if we have self-isolating, if we're living with people that are having underlying health conditions, despite how much vigor we have to help the community in this, we must not. We must find another way. Inshallah, there'll be lots of other ways that we will be able to assist the Ummah. So the actions of doing the janazah, carrying the body from the hospital, doing ghusl, doing the actual burial, only those that fit the criteria, inshallah, should put themselves forward. So today, alhamdulillah, you may be feeling absolutely fine, and we may all be feeling fine. But if the day, and you're more than willing to volunteer, But if on the day of your duty, you are showing any signs of any symptoms, then please do not attend. This is just for your benefit, but not just for your benefit, the benefit of your family, but more so also all the other brothers and sisters that will be volunteering on that day. So I cannot emphasize enough the importance that we should, inshallah, self-monitor and self-regulate. And if you have any doubt, you can contact any of the brothers whose details you will have if you are capable, if you should or should not attend on that particular day. We as an organization, alhamdulillah, have many experienced brothers who have dealt with this for many decades. We've got Zubair Bhai on the call today as well, mashallah. We've got Salim Bhai as well, who may or may not join us in a little while, but they have years and decades of experience, and they'll be able to answer any of your questions, inshallah. And throughout the whole process, we will always be there for you. So there will always be somebody at the burial, there'll be always somebody there at the GHUSL, there'll always be somebody there when we're picking up who has had experience of these things, so you will not be left alone at any stage at all. If after you have agreed to attend a particular process and you say you are going to come and then you feel unwell, and if you cannot make it, then please can I ask that you let us know as soon as possible so that we can make other arrangements. I hope that we are wrong, and I hope more so than possibly anything in my life that I'm wrong, that the numbers are not going to be as high as some people are suspecting, but we would rather prepare for the worst and hope for the best, inshallah. So therefore, a time will come that this will be on a rota basis, and inshallah, if you can't do it now, you will feel better in the future, and then you can assist us at a later time as well. So the most fundamental thing I'd like to reiterate again is don't take any risks whatsoever, inshallah. There'll always be somebody from the organization that will be able to help you, inshallah. And please familiarize yourself with all the procedures. You've all been sent a link, you've all been sent a video, an information video, from donning the PPE to doffing the PPE to how to perform all the ghusl and the carrying. Please familiarize yourself with that as much as you can. Watch it several times, go through it with your family members, inshallah, so you feel as confident as possible on the day when it's your turn of duty. And also after Dr. Safraz's presentation today, please feel free to ask as many questions as you want on the chat, as Ahmed Bhai said. So by emailing or texting at the bottom of your screen, we will get the questions, and we will endeavor to answer the most common questions. We probably won't be able to answer all of them, but those that are the most common, we will inshallah try to get back to you as possible. Allah subhanahu wa ta'ala accept our efforts, and please forgive us any of our shortcomings as well. So now I'm going to hand you over back to Brother Ahmed, who will hand you over to Dr. Safraz, inshallah. Jazakallah khair.
Jazakallah khair. Dr. Safraz, you're on now.
Jazakallah khairan. Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Sarfar Shahid. I'm a GP in Leicester. And alhamdulillah, Allah subhanahu wa ta'ala blessed me with the honor to work with, mashallah, very experienced and caring brothers and sisters who are, alhamdulillah, volunteering for the sake of Allah subhanahu wa ta'ala. So, to reiterate, the most key important point here is your safety is the priority, because for the marhum, the mayyit, the deceased one, he's going to have many options, but for yourselves, there aren't any options, unfortunately. You must be well, and you must be safe. If you're not well or you're not safe, then the ghusl does not go ahead, and you speak to your senior, and inshallah there'll be alternative options. So inshallah that will be reiterated again and again. So inshallah what we'll do now is we'll go through the PowerPoint presentation, inshallah. So I'm just going to share the screen. Bear with me. Bismillah. I'm not going to go through the entire details because this will be available for you on the link, inshallah. It's better to do it on the computer so you can see the full presentation, because there are videos, you might not be able to see them on your phone. But mashallah, Ahmed Bhai has done the PDF where the videos are accessible. So start Bismillah. So just going to get rid of these controls, inshallah, in front of me. Can everyone see the screen and the sound is okay?
Yes.
As well?
Yes, alhamdulillah.
Alhamdulillah, Bismillah. So this is about donning the PPE, the personal protective equipment. So essentially, just to remind my own self, the Prophet ﷺ said, the deen is nasiha, advice or sincerity. And the Sahaba asked, to whom? He ﷺ said, to Allah, His book, His messengers, to the leaders of the Muslims and the common folk. So with this in mind, we have to realize our ikhlas to each other and also the deceased. So our ikhlas or sincerity to each other is that we do our best, our utmost to protect ourselves, and then also our utmost to honor our deceased. But we still have the possibility to perform ghusl. So there's a big fear, of course, that we can't perform ghusl. But actually, all the public health authorities in the United Kingdom, United States, and Europe have said it is safe to handle the deceased so long as the appropriate equipment is used. And if you wanted any further information about this, you would have had a link to a folder, and there's some research in that you can have a look into, inshallah. So again, to reiterate what Shaukat Bhai said, the transmission of the COVID-19 virus from the deceased to those doing ghusl is thought to be less than from a living person. But in fact, there's no known case of a deceased person passing on the virus to a living person. But we still take all necessary precautions. And our strong advice, and the right thing to do is that if you're high risk, you must not perform the ghusl. In fact, if you are high risk, you should be following the government guidelines for what's called shielding. Shielding is basically staying at home, avoiding contact from the outside world, and that might be for up to 3 months or longer. There's a link. You can find out more if you are high risk. If you have any questions, inshallah, you may post them on the group. Inshallah, we can do our best to find the answer, inshallah. So a brief summary. There's 3 presentations. First one should be donning the PPE, putting it on. Second will be by ghusl. The third one will be by removing the PPE and cleaning up, inshallah. You're here on the Zoom call now. It will be advised that to meet early on the day of the ghusl to talk about the putting on the PPE, talk about the processes, and then inshallah with how we go forward, inshallah, is that we'll get a team together. The aim is to have an experienced person, experienced in doing ghusl, alongside someone with some medical experience together in the same team, along with the other brothers and sisters who have not experienced much ghusl or much medical experience. So inshallah, everyone can benefit and learn and develop quickly, because it's going to be important. Like Shaukat Bhai said, when the volume of deaths and the speed of deaths that are expected, we'll need people to be ready very quickly, inshallah. And then inshallah, over time, we'll have more, if needed, we'll have more Zoom calls to update you about what we'll be doing, inshallah. I think there's some questions. I think, Ahmed Bhai, are you monitoring the questions, inshallah?
Yeah,
so,
inshallah, we'll take them at the end.
Jazakallah khairan. Okay. So, of course, there's an issue about, must be aware that it's very difficult to source the equipment. So, but we're doing our best to find it. We will only go ahead with the ghusl if we have the right equipment. If the equipment's not available, then we'll have to make a decision on whether or not the ghusl can go ahead or whether it can be delayed. But if the equipment is not available, we do not take any risks. We don't do the ghusl. So checklist before starting: check your own well-being, your physical well-being, make sure you're well hydrated, you don't have a fever, you don't have any symptoms. Your emotional, spiritual well-being is very important. You must remain calm and focused. This is an act of ibadah. And then physically, of course, remove your jewelry, tie your hair back, and wash your hands before putting on your PPE. Sometimes it's very difficult to remember the sequence, so try to remember in this order. So it's going to be the biggest part first, which is your gown, then top, your mask, goggles, and then your gloves at the end. So gown, mask, gloves. So we'll be expected to put your boots on before you put your gown on. So this is a picture of what the appropriate PPE should look like for doing the ghusl or the equivalent. So he's got a visor on to protect his eyes. A goggles will be sufficient, inshallah. So if I won't play the video now, but please feel free. I would advise you to watch the video 3 or 4 times. This is a Public Health England video about how to put on, how to don PPE. Do it with your family at home. Try anything that you can substitute the PPE with, gowns, etc., kitchen gloves. Try it a few times, inshallah. And don't worry, on the day, inshallah, we'll have a buddy who'll be able to help you with it, so you won't forget. So don't worry so much, inshallah. So that's about a 7-minute video you can watch. So of course, you may be aware of the beard issue. Of course, the beards do cause a problem with the seal around the mask. The mask, it's a special mask which is supposed to create an airtight seal around the face. So it will go around this part of the face, and to stop any of the air flowing around the mask into the mouth. And beards have shown to cause a leak. And the advice for people like intensive care doctors was to shave off the beard, as in advice from the public health department, was to shave off the beard so that to protect themselves. Of course, we're not going to advise that. We're trying to find ways to get around it. Normally there's a hood, but the hoods are also very difficult to get. But if we get the we call the coverall. The coverall is like like an all-in-one, like a baby suit, which has a hood. The hood can go over the beard, inshallah, and maybe possible that will help create a seal. The alternative thing is to use Vaseline, but inshallah we can work around that as we are learning, inshallah. So just a quick review. So it's gown, mask, goggles, gloves. And normally the gowns are tied, so they put in from the front and then tied in the back. The mask is put on, and then you'll have it's got a malleable border, which then you basically push into the sides of your face, your contours around your face, so then there's no leaking, inshallah. So both the goggles or the visor are fine, and then the gloves in particular, they go over the gown. Okay. I know it's a quick run through, but please watch the video, go through the presentation, inshallah. Okay, to continue to the next section. Is that okay, inshallah, to go to the next section, part 2? Okay, bismillah. So this is the more complicated part. So there has been some changes since we issued this training, and we'll talk about it when we get there, inshallah. So again, to remind myself, although it may be a very difficult and stressful time, just remember that what you're doing is a beautiful trust to your fellow Muslim, and be grateful to Allah subhanahu wa ta'ala, have shukr to Allah subhanahu wa ta'ala that you're given this opportunity to do khidmah for your Muslim brother or sister. And this is a great opportunity for, as the Prophet ﷺ said, remember death, and remember more often the destroyer of pleasures, which is death. And this time that you will be doing the ghusl, make it a time which is mindful. And remember, this one day will be myself. Someone will be doing my ghusl. So your checklist before you begin the ghusl. So there's about 12 things that will be very important for you to check. Inshallah, this will be a printed checklist, inshallah, to be available on the day. The surgical gloves, apron, which will go on top of the gown, the shroud, which we'll talk about, the kafan, we'll talk about later, inshallah. Towels, normally we just do 2 large towels for the body, but we should have 1 small one for the face. Large cloths to shield the awra. The awra is the required area that should be covered at all times, which is technically the navel to the knee for men, and actually from the neck down all the way down to the feet for the women in some circumstances. Then we need some warm water, camphor and perfume, other essentials like soap and shampoo, cotton pads, surgical tape, clinical waste bags, a black bag for laundry, and then the ghusl area cleaning equipment, which we'll talk about at the end, inshallah. So to summarize the ghusl itself, there's 4 elements really. First is to remove essentially everything. So it's clothing, any medical equipment, that might be things like cannulas, tubes. Wash away anything which is filthy like blood and waste. and then cover any wounds, and you'll do that with some cotton and the surgical tape. And then you'll make wudu like you would make wudu for salah, and then you would do ghusl for the deceased as you would make ghusl for yourself, but there are some differences that we have to keep in mind for infection control. And then simply dry, perfume, and shroud. So think about the process much like as you would do if you're getting ready for Jummah or Eid. You would wash, make wudu, make ghusl, and then dry, and you get dressed in your white clothes. Very important points. It's a stop check. Will be do not proceed with ghusl if there's no equipment or it is not the right type of equipment, and there'll be a checklist of what the right type of equipment will be. If there's not enough support, so there has to be the right number of people, because it can't be done by yourself or with not enough people, because the process has to be very slow and careful. Or there's this in a condition which doesn't allow ghusl to happen. If there's any instructions on the bag, and there have been some cases where the instructions on the bag is do not open. If that's the case, do not open the bag and follow the instructions. If unsure at any time, speak to your senior. And again, to remind ourselves, the welfare of the living is prioritized over the welfare of the deceased. So do not take any risks with respect to there's no need for any heroes, inshallah. There's just be sensible. Don't take any risks. All of this has been well researched. We're following strict guidelines. The brothers, have worked very hard to ensure the well-being and safety of those volunteers who are doing this. It's an amana. It's a big amana. So a basic introduction to ghusl. There's a nice video to watch. I think it's a 12-minute video. I won't play it now, but alhamdulillah, it documents the ghusl process. Again, just remind the 4 steps. First is removal of the clothes, the blood, the waste, any equipment. Wudu as normal. Ghusl, not as normal. There is some caveat to the ghusl. And then dry, perfume, and shroud. Some very important points to keep in mind. And I said many things to keep in mind, but so whilst the ghusl is going on, you might find that your hands are wandering. Maybe you're scratching your face, and try to keep your fingers interlocked, and keep them up on your chest. That way, your fingers won't wander, inshallah, and won't touch anything which is contaminated. And at the same time, you won't be touching your face or anything which is it can introduce contamination to your face and your mouth. Now, the studies have shown that the waste products, i.e. stool, feces, are infective, and they stay infective longer than the respiratory product, meaning the things that are coming up from the lungs. So the stool products are more infective than what's coming out the mouth. So after speaking to some burial experts, they've said, do not press on the stomach, do not force any excrement out. It's better not to be put at that risk. So instead, just wash the filth, the najasa that's already present. And what I advise is, there'll be, of course, one person who's the senior person who's going to be leading the ghusl, who'll be doing the washing. The other people will be supporting and holding the cloths to cover the aura, or to cover the nakedness of the person. The person who's doing the washing should definitely have 2 to 3 pairs of gloves on. Once they've removed the najasa, to gently take off 1 layer of gloves and discard, so that you have a clean layer underneath. And we'll talk about some of that later on, inshallah. And regarding the towel, have a small face towel, inshallah, to use for the face only, because again, the mouth and the nose are a site where infection can be spread from. I know I'm rushing through some of this, but it's all available for you to take your time and go through, inshallah. A couple of, again, important things. When the bag arrives, normally we should expect that it's not going to be inflated, because the body will be seen in the mortuary at the hospital, and they'll have to open the bag to do that, and any gases will be released there. But if there's a delay, it is possible that gases will build up in the bag as the body begins to decay. And now it's argued that the gases themselves may be infective. So we need to release the gas slowly. Our suggestion was to put in a little needles and a syringe, a 50 to 100 ml syringe, and slowly take out the gas from the bag before opening the zip. That way the gas is not going to escape and spread out in the room and or over the person who's opening the bag. Once you've opened the bag, so some people have said that in other funerals that the person will have a sheet or a towel over the face that can be removed, and we can use a simple surgical mask on the deceased that will help stop any vapors or moisture leaking from the deceased airway, which may be infected. So after watching the video, the GHUSL video, you'll notice the steps. So again, just covering over the steps. So we cover the deceased with a large cloth and remove any materials, any clothes. You cut the clothes away, remove any catheters, dentures, needles, cover any wounds. And again, stress, do not put any pressure to relieve the waste, which is the stool, the feces, the human waste products. So normally the head would be lifted up or pressure will be put on the stomach. In this case, we won't do that because the stool it can be very infective. The washer, as in the first washer, they will wash away the blood and waste, and gently the other helpers will tilt the body to the left and right to help wash around the back and the private areas. The entire body should be washed, and this is before the first wudu is made. Again, be careful with splashing, be careful and do it very gently. Again, one of the advices is that this should be done by someone quite experienced with the ghusl already, so they know the process, because it has to be done quite gently and carefully. If the first washer is not able to remove their gloves, or they're going to have to remove the gloves, wash their hands, put on another set of gloves, and then this is going to potentially cause infection, they should try to switch with another washer, so then the other person can continue the ghusl. And then it's wudu as normal. Careful with the mouth. Again, remember the mouth. So the mouth area is going to be quite infective, and also the back passage is going to be quite infective. And then, of course, a reminder of what to do with the hands. Try to keep the fingers locked and on your chest so they don't wander around, inshallah. So this is now after the wudu is done. Then washing the hair, untie any braids, a gentle, quick soaping of the body top to toe, rinsing it all down. In some cases, we might, especially if there's a large volume of people to deal with, lots of people are passing away, it may not have an opportunity to do the second or third washing. But we will try if you have the opportunity to do the second and third washing. And the third washing is going to be with a camphor. It's a nice smelling substance of the Prophet advised we wash our deceased. Dry down the body with the big towels. Use a separate towel for the face. And then dry under the table, and then we can then begin with the shrouding of the coffin. So the coffin, so it's going to be 3 pieces for men, 5 for women, and it's essentially going to be a 2 outer wraps, the lower garment, and then the qamis, the shirt basically. So 2 outer wraps, the lower garment, and the qamis. And so the qamis is cut with a slit, and it made a little V shape that's rolled up, and there's a couple of videos to help show you how to do that. So at this time now, because the deceased is now more clean, again, you still need to maintain all your protective equipment, all your protective strategies, but just they are more cleaner now. So you have to remove your dirty gloves from the ghusl, so now you have a clean set of gloves on. So applying the coffin, there's 2 videos, one for men and one for women. You can watch both. And the Ibn Masud radiallahu anhu said the camphor, which is a perfume, is to be put on the parts of the body in which one prostrates, which are the forehead, the nose, the hands, the knees, and the feet, because he used to prostrate on these parts. So they are deserving of the greater honor. So then this is once the body is put onto the coffin itself, this will be a good time to put the perfume on the places of sajda. Again, you can watch the videos on the presentation, inshallah. So quick review, inshallah. So for the coffin itself, it's recommended to perfume the coffin. And I didn't mention the tying strips. The tying strips should actually be placed underneath the coffin. So when you're rolling the coffin, you have the tying strips to tie and bind on top. The wrap layer by layer, start on the right side, and then bind the tying strips. And again, don't forget that although this is a process, and we're so worried about infection, this is still something to be mindful and use this opportunity to help our own iman. Alhamdulillah, the coffin is complete, and now we have to hand over, inshallah, to the transport team. I've summarized a lot of the infection control things that you need to be aware of, inshallah. So when handing over, some funeral directors are putting the body into a fresh body bag. Some are putting into a coffin for transport. Either way, just to wipe it down with the hospital wipes, and then we'll go to washing down the GHUSL area. And inshallah, so that's going to be the next training section, inshallah. I believe someone has a microphone on. Would you mind kindly to switch it off? Jazakallah khair. Okay, so now we call doffing or removing the protective equipment, the personal protective equipment. Okay. Inshallah, so now this can be done nice and slowly. That's a very important thing. Do it nice and slowly. If you've forgotten, it's okay, don't worry. You can ask a buddy, you can ask the people with you to help you and just to guide you through it. Some very key points. Imagine the entire outer area of the PPE is contaminated. If at any time the hands become contaminated, you not to worry. Wash or use alcohol gel immediately, and advise alcohol gel because then you don't have to leave the place you are. Don't go into any area which is deemed clean until the PPE has been removed and binned. So the diagram shows that's a ungloved hand going behind the glove and pushing off the other glove, and that's shown in the video here on the other side. So just try to remember the sequence, inshallah. So this time it's gloves, then gown. Normally we would say then take off the goggles and mask and wash hands properly. But what we're going to do is take the gloves off and the gown off, then wash hands at this point and put on a normal disposable apron and a fresh pair of gloves because we have to start the deep clean of the GHUSL area. And then we repeat the cycle again. So when the deep clean is done, you remove the glove, and this time the apron, then the goggles, then the mask, wash hands properly. Okay, so it's gloves, then gown. And in fact, the gloves and gown can be removed together. They may be a bit tricky, but inshallah, see how you feel. Again, it's worth trying with whatever you have at home so that you're confident on the day, inshallah. So so the video here will show you again how to do that. So it's a nice slow video, and they show about how to wash your hands in between the steps as well. So quick review. So you'll do the gloves and gown first. Here's a little picture of how to do both together. So gloves and gown together. It can be done from pulling the front of the gown off. So you break the straps, and then you never touch. So you as you're gloved, you only touch the inside of so as you're gloved, you only touch the outside of the gown which is infected. So then you slide your hands out. Then you can touch the inside of the gown because that's not infected, and then you make it into a ball and throw away. Alternatively, you can remove the gloves. If you're removing the gown, you reach, you have to take your gloves off, do the hand washing, put your hands behind your neck and unstrap. And then again, you don't touch the outside of the gown. You only touch the inside of the gown, putting your hands inside. But what we're going to do, after taking the gown off, we get ready for cleaning. We wash hands properly, put on a standard apron and gloves for cleaning. And then once the cleaning has bin completed, we repeat steps 1 and 2. Cleaning is very, very important because we don't want to expose the next brothers and sisters coming in to any virus. So we have to take some responsibility for that. Once that's completed, again, you do gloves, then apron, remove the goggles, and then the mask. And just try to remember that anything that's been exposed into the front is likely to be contaminated. Okay, so regarding cleaning, so the Department of the Public Health England guidelines recommend a hospital disinfectant. If we can't use it, then a diluted household bleach, which is 1 part of bleach to 5 parts water. No, I've written 1 part water, 5 parts bleach. It's the other way around. It's 5 parts water to 1 part of bleach to clean the surfaces, and allow it to air dry if possible. Please ensure the entire GHUSL area is tidy, including things like putting kaffans back, putting the equipment back to where it was, and things like handles and everything are wiped down, and then the bags are taken with us. So the final steps, which are important, of course, thank your team members and the GHUSL facility providers, and you take some time to reflect on this day and what's happened, how you benefited from it. Inshallah, there will be a form going up, inshallah, and that's for auditing or review purposes. So it helps us to know what we need to do in order to fix any problems or stock up on things that we need, inshallah, and also to learn how to do further ghusls, inshallah. So that's the end of the training, inshallah. Jazakallah khair. So there will be some PowerPoints going out regarding the nature of the equipment and what is needed, inshallah. So inshallah, I'll hand you back over to Ahmed Bhai, inshallah. Jazakallah khair.
Assalamu alaikum. Jazakallah, Dr. Shahid. Safra, sorry. Yeah, we've had many questions as well. Inshallah, we'll go on to the questions in a little while. Just make sure Zubair Bhai is ready as well for those questions, so we can unmute him. Yeah, so we'll take the questions. I just want to bring in Sister, let me see if I can get her on the line. Just bear with me. Just got a message from one of the volunteer. Well, gotta find the name. Anyway, whilst we are waiting for the sister, what I'm going to do is I'm going to ask a couple of questions. Let's make sure. Zubair Bhai, you ready for the questions, Brother Shaukat?
Okay,
yeah. Salim Bhai hasn't joined us, and we are full. If anybody has messaged, if one of your friends have messaged you personally on here to say we've not been able to get on, please do send our apologies. But there's going to be a second and a third call, so those who have missed it today, inshallah, they can get on. But we can only fit 100 people on here, and we've had to do it in a short time, so we weren't able to get any more on. So I've got some questions here. Dr. Sarfraz, we're going to need you on as well to answer some of these questions. Okay, so one of the questions is, how many people would we need for a ghusl? Zubair Bhai.
I think that's best for Zubair Sahib, inshallah.
Zubair Bhai?
From my personal experience, you need 4 at least.
So a minimum of 4, yeah?
Yeah.
Okay. If there's no PPE, what happens?
There's no ghusl.
No ghusl.
Mm-hmm. Or, I mean, if the PPE can be found, and then the mayyit can be, it can be left or weighted, then it's fine. But if there's no PPE, there shouldn't be any ghusl.
Shaukat Bhai, what's happening with the order of the PPE at the moment? Have you got any idea?
Alhamdulillah, we have preliminary we've got an order, we've got some available as well at the moment. Inshallah, we should have enough PPE to go through as long as the situation doesn't get exacerbated even further. We should have enough, inshallah. But as Dr. Sab said, if we do not have PPE, we will not be performing ghusl.
Okay, I think this one's a question for Dr. Safraz. Would the mask and goggles go over the hijab?
The mask and goggles, inshallah, there shouldn't be a problem, inshallah. I would think the hijab may have to go over the mask, because the mask has to be tight-fitting.
Okay.
So if the hijab is going to interfere with the fitting, it's better for the mask to go underneath the hijab.
Okay. Brother Shaukat, where are the ghusl facilities in Leicester?
We have a location Zubair may be able to back me up on this. I don't want to mention the name of it. We're 99% secure. As soon as we are 100% secure, one facility has been made available, inshallah, but until it's 100% secure, I'd rather not say, but we do have a location in the city center, inshallah, that where all the COVID-19 funerals will take place, because we do not wish to take them to lots of places unless if we have to, for the fear of cross-infection. So we're just going to use one place to do as many of the ghusls as possible, inshallah.
Okay. We've got here, someone's asked a question. If someone passes away, not COVID related, does this process need to be followed whilst the pandemic is on? Dr. Sarfraz?
Not necessary. Not necessary, because if the person has passed away in a natural death, then there isn't an issue that you have to follow this particular style of things, but a bit more cautious is expected.
Okay. Dr. Sarfraz, your thoughts on that one?
So it's not an easy answer. We had this discussion with the brothers and the other doctors who are on, because the scenario is changing very quickly, and it could be a time that comes where there'll be people who are dying who don't know whether or not they have COVID or not. So there may be situations where the patient is positive for COVID but not being tested because they're only being tested in hospital. So if they're tested, they won't be tested in the community, and if there's a death in the community, and they may have died from natural causes like or from cancer, for example, and they're not being tested, we'll have to then make a decision of whether or not we go for full PPE or whether we take a risk. So it's a very difficult scenario, and it's going to have to be discussed.
I think when we discussed initially, Zubair, if you don't is
I think
exactly as Dr. said.
Yeah, there is the only way we will know is when the death certificate is issued. It is made clear on that.
Yes.
So that's something we can go on with. But having said that, I mean, we've had 3 deaths this week that I know of, which came from out of town, which I dealt with, and they were all of natural death. We didn't go with a full PPE, but we went with a basic, a bit more than what we would normally do, to be honest.
Yeah. My advice would be as cautious as possible. Because as Dr. Saab said, none of us know if we're carrying the virus. That's why we're all staying at home. So somebody may have died, say, for example, a car crash or another illness. That person or that individual may be still carrying that virus. So therefore, as Zubair said, we'll be a little bit more cautious than we would normally be and performing the ghusl with safety equipment.
We're going to move on to the rest of the questions so we can try and answer as many as possible. Would you say everyone helping with the ghusl should wear 3 sets of gloves, as they will all be touching the body during the process?
I don't think necessarily. I'm not sure how it will work. Maybe it's a possibility, but it's a learning curve. So you may find that not everybody needs to do that. I think as we do more ghusls, we'll know. But maybe initially that might be a good idea, inshallah.
Okay. I've got here, how long does the full process take?
The normal ghusl takes just over an hour. So this will probably take a bit longer. I would say an hour and a half, maybe more. It depends. If the person has come with an autopsy, it'll even be more difficult.
Okay, next question. Some relatives wish to see the deceased person's face. So is the tie around the head to be left slightly loose?
I'd leave that.
And I'll put the second question in as well, because it's probably related. What is the role of relatives? Are they allowed to attend, observe?
If it's COVID-19, what are you going to do? You can't allow the family because they might be infected as well. This is what's happening across the country, where families have not attended their own father's funeral. They haven't come to the ghusl either. So this is something you cannot make a light decision. If the family insists, what are you going to do? You're going to tell them no? It's a very difficult answer to this one, a very difficult question to answer. on the day, on the ground, we have to make a decision.
Yeah, I think the situation will be, Zubair, extremely difficult. I mean, if we all put ourselves in that position, I think education is going to be the factor. That's why we've been putting out the information and the flowchart that everybody may have seen by now. But if a family member has passed away of COVID-19, immediate family members, in most cases, will be self-isolating. They'll all be self-isolating. According to the government regulation, you will not be legally to be allowed to leave the house and therefore attend the ghusl, attend the janazah, or picking up the body, or do the coffin, or do the burial, sorry. So legally, they're not allowed to do this. Obviously, it's a very emotive matter, but if you've been anywhere in contact with the deceased, you will not unfortunately be able to come to the ghusl or to the janazah. The regulation that have come out today, that at the funeral itself and the cemetery, they are restricting the number of people that can attend this, and social distancing will have to take place. There'll be no shaking of hands. There'll be no hugging. There'll be only the volunteers will be able to do the digging, and there'll be no sharing of the handles either. This is going to be a very unique funeral, as I mentioned in the beginning. Therefore, I think we need to start educating the community of a very difficult time ahead of us. So at least they are a little bit prepared that there will be no family members allowed to come to the janazah, to the ghusl, or picking up the body if they have been anywhere near contact with the deceased.
Okay. Salams, will the government provide the PPE since they've changed guidelines about handling COVID-19 bodies, arguably because they don't have enough? Or do we source it privately as a community? Currently, like I said, we do have some. We're trying to source, so if anybody can help with this, or directors, inshallah, it will be greatly appreciated. But like I said, we have some, but we don't have enough. But inshallah, we can get some more. Am I right, Shaukat?
Yeah, are you at liberty to say who's donated some already?
Yeah, we can say that.
Yesterday?
Yeah, I think we got 50 suits from Ummah Welfare Trust. Alhamdulillah, they donated 50 overalls for us. They also donated masks, which can be used for collecting body and for also at the graveyard. But we're still trying to get hold of the masks that we can use, the FFP3 ones, I believe, or the FFP2 ones, which are going to be used for the ghusl. And we have some, but I don't think we have enough. So yeah, please make dua for that. And I just want to say Jazakallah to the brother who drove all the way up to Bolton to get those masks for us. Okay, should we be taking laundry away? Will it not be infected?
Potentially laundry is going to be infected. There is some advice on the government guidelines about how to treat laundry, but potentially it can be washed if it's handled properly. So it's normally allowed. On the government guidance, it says leave it for 72 hours before throwing away. But I don't think we can be throwing away that number of towels and things. So it could be possible to leave it for 72 hours and then wash with a high temperature wash. Maybe with some bleach in the wash should be okay, inshallah.
Okay, going to move on quickly. Go on.
Very quick. Sorry, do you want to go very quick? When we were discussing the science on this, the prevalence or the potential of an infection, it is very, very low. Bearing in mind, we still be extremely cautious.
Mm-hmm.
I
I don't have any figures. I haven't seen any figures in the studies. But the only thing that I've seen as a statement, as a definitive statement, is to say that the risk is lower on a deceased person than from a living person. But because it stays on service for a long number of hours, that's the problem. So then it can be infected there can be infectivity from a service for a very long number of hours.
Okay, someone's put here, is it possible to get the hospital staff to remove the catheter and the needles before releasing the body? I mean, this is always requested even on a normal day, and they do leave it behind, sometimes due to staffing issues or whatever. So as a family, if somebody is there, I think they should make sure that happens. But a lot of the times, I know from previous ghusls, it is left behind, they just don't have the manpower or whatever to do it, because once a person dies, then you're no longer priority. Okay. how likely is it that an autopsy would have been carried out on a COVID-19 patient?
This is questionable, isn't it? Dr. Saab maybe can answer that question.
I mean, it's going to be a case by case. So if the death is not just straightforward COVID, then something else is going on. Of course, then a post-mortem might be needed. So as likely as for anybody else.
Okay, I've got another one on here. They've sent it in privately, but basically what they're saying, Dr. Safraz, is that for women, they need at least a minimum of 5 people, especially depending on the size of the actual deceased. So if everyone can bear that in mind. With the mouth area being very infectious, how would you remove dentures, etc., from the mouth?
With care. You have to be very, very careful. And I'm not sure if Zubair Saab can answer. Do we ever leave the dentures in the ghusl?
In most cases, they leave them in. They don't force anything out of their mouth.
So leave it in.
You just leave them. Yeah. Don't do something that will harm the body. Do the minimum that you need to do with the body.
Okay, Brother Jahangir is coming in again. I thought that a non-COVID death, we would still do the same with PPE. Is that right?
So this is the argument. So if you imagine, say, maybe 30 COVID deaths, and then a number of other deaths on top, the amount of PPE required, the amount of skill required is just going to be, it's not going to be feasible to have so much PPE and all these people trained to do it. So it's not going to be feasible. So we have to find a strategy to somehow to work out in the future, inshallah. Inshallah, we'll work on it and we'll find out where to go forward, inshallah.
Okay. If there were numerous COVID ghusls at one time, would the PPE need to be changed for each ghusl if the same team were carrying out a few, one after the other?
It's difficult to say. I need to think about it. Maybe it's possible to have the same PPE, or the only problem is about how you take a body from a clean area into a dirty area without exposing yourself to the clean area. So there might be a way to do that, inshallah.
Okay, there are still a lot of questions. I don't think we're going to be able to answer all of them. We've got 31 new messages. What we can try and do is maybe address those questions offline, okay, and then we can put the answers onto a group, inshallah, the people who are on the group. Is that going to be okay, Brother Shokar?
Yes, we can try to do that, inshallah.
Okay, I think I lost my connection for a second then.
Questions. If we can collect the questions, inshallah, then we can do that.
Okay. I'm just going to bring Sister Khadija in, who's also one of the volunteers on the female side, just to have a quick word. I was supposed to bring her in early on, but I wasn't. I forgot to unmute her. So, Sister Khadija, if you can just you've got 2 minutes, inshallah. 1 second, let me unmute her. There we go.
Assalamu alaikum, everybody. Just as a quick mindset issue, when it comes to doing the ghusls on the day, everyone's going to be feeling of fear. Everyone's going to be feeling a little bit of a bit wobbly, maybe, because of the fact that something is going to happen in a more chaotic environment. So I would say to you, if you're going to feel like the kind of person who would probably pull out in that situation, it'd probably be better for you not to put yourself forward for that reason, because when it comes to when we make the teams of 4 to 5 people, where we'll have, say, sisters groups, where you have a medical person and somebody who's a lead ghusl, and then you'll have two less experienced people being coached by the lead, and then it kind of has a knock-on effect on the other teams as well, where somebody might not turn up and then I can't come because my family said I shouldn't go, or my husband said I'm not to go. It's more difficult then to, in a situation where that amana's there already, and the group has been informed, to then pull out at the last minute. So yes, there is a lot of fear there, which and everyone, it's quite right that people feel that fear. But if you feel that you're the kind of person that at the end, when faced with that in the last minute, you're not going to be able to go through with it. It's better that you say now that I won't be able to do this, rather than being in that position and then pulling out then, because it's rather sooner than later. And no one's going to feel offended or hurt by any of this. It's obviously everyone's, does what they can, and everyone knows themselves the best. But when you're in a group of people together as a team, you're all going to be relying on each other to look after for each other's well-being, so to speak. So it's really important that everyone's got is on the same page in their mindset. So the other thing I was going to mention is the groups of people. So we have the two less experienced, or somebody who's maybe not done a GHUSL before but only practiced it, with somebody who's done quite a few, so they can learn from that person and grow in their confidence. And there'll be a medical person there as well to make sure that infection control is adhered to in the way that the doctors have just relayed to everybody. Thank you. Jazakallah khair. Assalamu alaikum.
Jazakallah, sister. Okay, Brother Shaukat, is there anything else that we need to cover?
Now, once again, just reiterating, Jazakallah khair by yourself, Zubair Bhai, and Dr. Safraz as well for your contribution, and Sister Khadija as well, alhamdulillah. As I said, inshallah, if you do not feel that you can't do it, then do not worry. But you are our amana. Alhamdulillah, you've all stepped up and volunteered, and inshallah, by the grace of Allah subhanahu wa ta'ala, we will be able to do this. And everybody on this side are all volunteers too. We're all volunteers. We've all volunteered for this case. Inshallah, I've been working very hard for the last close to a week now, inshallah. So it has been a pretty acute operation, but inshallah, we will endeavor to answer all your questions. We'll fine tune the process. And one other thing that Ahmad Bhai said at the beginning is very, very important. Things are changing day by day. So if there's any new regulation, please try to keep up with it. We will try to send information to you as soon as possible as well. Familiarize yourself with the information that we've already sent out, the flow chart of how the processes work. Each team will have a lead and who will have a responsibility. So there'll be a nerve center who will be collecting the calls. There'll be a collection team with a lead who will be picking the body up from the hospital. There'll be a team that will be doing the GHUSL, and there'll be a lead there. There'll be a team that will be taking the deceased from the GHUSL center to the cemetery. There'll be another team at the cemetery who will be performing the janazah and the burial. So if you feel you can take part in a particular aspect of that journey, then say, I would like to be in that part of the journey. But as Zubair Bhai says, the most difficult possible part is the GHUSL part, and we'll probably need the most volunteers. Jazakallah khair and everything.
Okay, just want to finally say, if anyone does feel they want to step up into any senior roles, then just message on the group or message to the admin, inshallah, and then we can do that. Alhamdulillah, I know looking at some of the names on here and on the volunteer list, there are people with tremendous experience, and they should be actually here in the seat where we are, because, you have so much experience. But alhamdulillah, jazakallah to Dr. Sarfraz as well, who has stepped up, who's put the presentation together. We're going to have a second and a third call. So all those people who weren't able to come on because there's a 100 limit, inshallah, we will bring them on either later on this evening or tomorrow. But jazakallah as well for your participation. Any questions that you may have, any uncertainties or any ideas, please post them on the group. And the biggest thing is make dua, that we don't have to go down this road, inshallah. Jazakallah khairan. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh.